Hey, thank you for tuning in to Global Elite Academy. If you are interested in opening up a non medical home health agency, please go to globaleliteacademy.net. That's globaleliteacademy.net. If you have questions on any of these audios that I'm making, go to globaleliteacademy.net, look up the phone number, and give me a jingle. Now, on this audio, we're going to talk about the IHSS program in Alabama. Now, in Alabama, they don't have an IHSS program, but one that would be similar to it would be the personal choice program. And actually, Alabama and a lot of the states too, they have several different programs, community-based programs that you can use. Some are for disability patients, some is for elders, and some is for children. There's just different programs you can use. These programs are Medicaid waivery. Alabama Medicaid program offers several waiveries that allow family members to be paid for providing care to eligible individuals. Okay, so what you want to use, it looks like it's the closest to IHSS, is the personal choice program. This is a self-directed program. It offers flexibility and choices for in-home services. It bases care for seniors and individuals with disabilities. It allows individuals to choose their caregivers, including family member, and how their care is delivered. That is like IHSS. So you want to get, that would probably be the one, that you're going to get. The personal care program, here it is again, is self-directed home and community-based services. As I said before, it is designed to offer seniors and individuals with disabilities for care. Clients that's enrolled in the program can use their allotment budget to hire someone to help with their care. Okay. So now, when you're opening up an agency, you have to decide what kind of agency are you opening. Are you opening an agency that's going to take care of children? Or are you opening up an agency that's going to take care of disabled? Or are you opening up an agency that's going to take care of the seniors? So you have to decide that. And then that's what type of patients you're going to take with the IHSS patients. Now, there's already a shortage of caregivers. So I do not know if you decide, like, for example, to open up an agency that's going to take care of all children. I don't know if you're going to be able to find the caregivers to do that. Or let's say disabled. You may not, it's not going to be an unlimited amount of disabled people. You know what I mean? It's going to be a limit as to how many. It's just not going to be a whole lot of disabled. So seniors is going to be your best choice. Most people open up a non-medical agency for seniors. And you can open up one for seniors, and then you could do disability patients as well as senior patients. But most of the caregivers, probably their experience is going to be in senior. So then you can also take only seniors. It's up to you. But I doubt very seriously if you wanted to open up an agency, let's say to take children and seniors. I don't know if you're going to be able to find that, because you would have to find the caregivers who have had experience taking care of children 18 years old and under, as well as seniors. And usually it's not like that. It usually have either or. And a lot of these caregivers don't even work with children. Like when I was a certified nurse assistant, I worked with children and seniors. I had experience. I used to work in the hospital, children's hospital. But I remember a lot of caregivers telling me they didn't see how I could work with seniors, with children, because they couldn't stand to see children sick, and they just couldn't take it emotionally, being around sick children, where it didn't bother me. So I worked at Children's Hospital as a CNA, certified nurse assistant, as well as, working also in a group home, with seniors. So I don't think most people go into home care and they go into it for the seniors. So that's just something to think about. There's already a shortage. So you have to just think about what you want to go into. Like we also help people open up group homes. And I had called one of my vendors because they can tell you where to get patients at. And I asked them for disability patients, do they get them? She told me no. There was not enough disability referral patients, so they couldn't even refer that. The only thing they get referrals for is senior patients. So if somebody wanted to open up a disability group home, they couldn't, it would be hard for them to give them patients. And this is what they were. They were professional companies that give you patients, or you're purchasing patients from them. They said seniors, they had a lot. That's what they did. They all of their referrals were seniors. They didn't have any disability. And a couple of places told me they didn't have any disability, and maybe one said they may have one or two disability patients that they can refer. So you have to think about that when you're opening up a business, when you're opening up home care agency. Who is your servicing market? Who are you going to service? Are you going to service children, or are you going to service adults, or what? To me, when you're getting into servicing children, that's like a babysitter. When you're servicing children, so you really have to look into that. I know that there are some agencies in New York City that cater to pregnant women when they're about to have their baby, and they offer home care for them. I have never seen that service in any other state but in New York. And I guess it does pretty good in New York. This is why when you're opening up any type of business, you need to do a market analysis in that area to see what is needed in the area. Some people just offer services to offer it, and nobody ever calls you looking for that service because it's not needed in that area. So when you're going to open up a business, you got to make sure you know what you're doing and you've checked the area. You know what they need. Don't just open up a business just to open it because everybody else got one. You have to look and see what is your market that you're going to be servicing. Let's just say you're going to be servicing in Alabama senior patients. So that's the type what you want to be licensed for the IHSS, senior patients. So then when you hire caregivers, you want to hire caregivers that have experience working with senior patients. and then you're not going to have any problem. So you can't just go into a business and you're just going to do whatever they have. No. So again, in Alabama, they have the personal choice program, which is the same as the Medicare waivers. The Medicare waiver program is the same as IHSS, but that's what they call it in Alabama. There are other services that they have too. But if you want to do the senior one, and where they're going to be be over self-directed their care, they can get their family members or care an agency, self-directed care. That is the same. It's a Medicare waiver program. That's the same as IHSS, but it's just a different name in Alabama. Now, I did not give you all the phone number or the websites to these places, because sometimes you have to really go through that. The website didn't change, and I don't know. It's just, anyway, what I'm going to do is I'm going to go back over, I'll put that on a separate audio. And I'm going to do all the regulated states and all the unregulated states. And then I'll tell you the website or the phone number to go to for you to apply for your license for IHSS programs. And I'll just give you the list, like Alabama, Arkansas. I'll just give you the number like that. And you can get it like that, because I really have to go through that and do a lot of research to get where you going to apply. But now if you want to apply before I get the information, that's why I'm giving you the name. All you have to do is Google Alabama Personal Choice Program, and you know that that's the IHSS program, and then you could take it from there and see where you put in the application. But if you want to wait on me, you're happy to do that too. So I think that's it. Right now, I'm doing all of for the IHSS programs, because in each city, in each state, the name is different. And it's very hard when I'm going through telling you what's regulated and what state is not regulated. And then I'm not telling you about the IHSS program, because it's different in each state, or the name is different. So I thought I would just go back and just do the IHSS. Tell you if the state, again, is regulated or non-regulated. And then just put in extra information. I think I did a audio the beginning of this month, and I strictly gave out all of the states that were unregulated, meaning all of the states that you did not have to get a license to operate a home health agency. But you do, if you're going to get IHSS, you do have to get the license for that. Now, when you apply for IHSS, all of these states charge you a certain amount. Like I think Arizona, and each year the rate goes up. I think Arizona this year, they charge you $731 when you apply for the IHSS program. And it's named something else. I don't know what the name is right now. But they do charge you. It's just like when you get your license for non-medical agency, you still have to, the state charges you. You're not getting your license for free. You have to pay for that. So I'm not putting the price on, because each state is a different price. I'll also go back and tell you how much they're paying, because I don't have that information either, if you're going to be sending caregivers out. Okay, so that state we just finished was Alabama. You all have a really good week. See you next week.